We have an oral presentation from lovely colleagues from Scarborough Health Network coming right up. I just want to take a second to introduce both Dr. Michelle O'Connor, apologies, Michelle O'Connor and Lana Gregoria, who will be presenting on the co-designing high-quality, cultural-safe sickle cell disease care through community and health system collaboration. Before passing the Before passing the physical microphone over to folks, I just want to let you all know that we received a series of very compelling, very well put together abstracts, and it was very, very tough. The adjudication panel and myself took a very thorough look, and this presentation in particular stood out amongst the pack. So we wanted to provide them with the fortunate privilege, or actually we had the fortunate privilege to hearing live and direct from these two lovely speakers, who I will now pass the microphone over to. Over to you.
Thank you, everyone, and sorry for interrupting lunch. We'll keep it quick, and we'll start with Health and start off. So our topic is co-designing high-quality, culturally safe sickle cell disease care through community and health system collaboration.
So thank you all for listening to our presentation. Our journey began in Scarborough many, many years ago. We've had a pediatric satellite clinic since 2003. And over the last couple of years, we've done a lot of work to hear from our community. And at the time of when we started this journey, there were only two pediatric satellite clinics, William Osler and SHN, apart from Sick Kids. And there was no adult sickle cell clinic at Scarborough Health Network. So some of the things that we heard from our community was the emergency department care and the time it took to get pain medication. And what we've been hearing today, I've been hearing the word accountability a lot. So one of the strategies that we used is to hold ourselves accountable and make this metric part of SHN's quality improvement plan. And this metric comes from Health Quality Ontario as an optional indicator for health equity. So the indicator is the average emergency department wait time for a physician initial assessment. And we use that as a proxy measure for getting adequate pain management as soon as possible. At the time when we created this, we didn't have an easy way of pulling time to pain management as easily as we had the metric for physician initial assessment. And our baseline, when we first started our work, was 66.7 minutes. And we had a target to get to 15 minutes by March 31st, 2025.
Sorry. So these are the techniques we use to try to improve our initial physician assessment. So we felt it was very important to co-design our sickle cell disease care with patients and families. So we held two town halls, one in November 2023 and one in February 2025, where we set up a series of activities that helped sort of track the patient experience through the emergency department, the inpatient unit, as well as outpatient clinics. And we use this to sort of streamline or to sort of target where we're going to focus and how we're going to improve. We've also onboarded a patient and family advisor, and we've had community engagement session with the Taibu Sickle Cell Awareness Group. So these were the sort of main three themes that came out of these town halls. So first one, we've heard about this quite a bit today already, is our healthcare provider knowledge. Number two is the patient experience and equity. And number three is the transition to adult care. So we use this again to target where we're going to focus. So with staff education, we obviously had available SCAGO sickle cell disease training. The TASN anti-Black racism was made a requirement for staff. I believe our completion rate was about 75% for the hospital. And then also SHN training for compassionate care. We've developed a dedicated sickle cell team, and we've also had multiple education sessions, such as interdisciplinary huddles. We had invited speakers from sick kids to give us rounds, as well as physician-led rounds, and we use this as well, M&M rounds, things like that. Another way what we focused on was chart reviews. So in our biweekly meetings, we would go through every patient that came to the Emerge, and if they didn't meet our targets, physician would go through the chart and try to identify where all the, what the issues were, and we would directly feed back to the nurses as well and the physicians as how they could improve, and just, use that as education. And through this, we were using a standardized audit tool to track the numbers, our PIA time, and our time to pain medication, and again, to really break down each individual patient experience. And as I mentioned, we do this in our biweekly meetings with interdisciplinary team, big group of us that would do it every few weeks. Another thing we used is we leveraged Epic. So one thing that's been quite helpful is as a patient enters the Emerge, they get registered at a kiosk. So this is before speaking to a triage nurse or even a registration clerk. So you're going to put in your chief complaint, and you can identify as having sickle cell disease, and this is flagged to our triage nurses, so we can pick these patients and have them triaged even more quickly. We've worked on our standardization of our order sets as well as with evidence to practice, so that we using the most up-to-date evidence to guide our order sets and making sure that our staff and physicians are using the order sets. Another big one that was very effective, thanks to UHN, I think, for their suggestion, was directly Epic chatting with a physician. So the triage nurse or the RN who initially saw the patient would Epic chat and say, hey, this patient is here, they're in this room, please see them as soon as possible. And this was very effective in getting our patients seen very quickly. And then we also have an Epic flag for sickle cell disease. So this, again, alerts the triage nurse to the patient's status. Okay, so these are our results. Oh boy, this didn't turn out. So I guess initially, so this is our PA time. So starting in September, let's see if we can get this here. September of 2022, so these are our PIA times, 117 minutes, 72. So these were, you can see, these are certain PDSA cycles, such as our education, chart reviews, FYI flag, and then this is our introduction of the Epic chat. So you can see how our PIA time has improved quite significantly. So 7 minutes in July 2024. So this is over the last about 1 year. I did average these out. We're at an average over the 1 year, under 15 minutes. So again, things change month to month, and obviously it highlights the importance of continual education. And once we've achieved something, we want to maintain it. So that's important as well. So our baseline was 66.7, and we've improved by 46% from our initial. Okay, 2 more minutes. Thanks. We're almost done. Okay, so quickly I'll just pass it back to Michelle. We've got 2 minutes.
So when we first started our journey, we really used the Ontario Health Quality Standards to guide our practice. We did a self-assessment on ourselves in 2023 across the organization. You can see there's some areas there that we really felt like we could improve. We've done a post survey of ourselves to see where we stand. There's still lots of opportunity to improve. As Dr. Gregorio said, we have met one metric, but there's so many other pieces that we need to continue to improve on. And the key takeaways, I think it's so important to co-design with families and patients, people with lived experience. When we first did the town hall the first time, our main focus, we thought, was going to be rebuilding our outpatient clinic, our pediatric clinic. And what we heard from the community was the lack of adult care. And that changed the whole trajectory of what we were going to do at Scarborough Health Network. And we then built an adult care clinic based on that feedback. So it's so important to hear from patients and families. The Ontario Health the Ontario Health Sickle Cell Disease Quality Standards were a roadmap for us and really helped us strategize how we were going to tackle each component of our action plan. And I think the other key takeaway is we have a really collaborative approach at SHN. It's great working alongside Dr. Gregorio as she's an ED physician. We have a whole interprofessional group of staff that work on our committee. We also have senior leadership that hold us accountable. So I think we have our emergency department, medicine, pediatrics. All of our departments working together for one shared goal really does make a difference in the hospital. Like I said, we have a new adult sickle cell disease clinic, and Taylor is our nurse. She's in the audience.
Go Taylor.
So we opened June 4th. We started off with a phased approach. We had a lot of feedback from our patient family advisors who did help us with some walkthroughs. And there's a hematologist, a nurse, and a social worker currently. And part of the whole new model of care is to have one team that sees both pediatric and adult patients so they can see the whole journey from the patient's point of view. We're continuing to build our team. The next steps we have is really looking at our time to pain management in the ED. We are looking at that at our biweekly meetings, but there's still opportunity to improve. We want to continue our staff education, and we are developing a sickle cell disease patient advisory committee. And one of the things that we want to do is develop individualized care plans that can be available on our EMR so that when patients come in, they don't need to repeat their story over and over again. Thank you so much.
Beautiful. Big thank you to Michelle O'Connor and Dr. Lana Gregorio. Thank you so much for that thoughtful presentation on the great work happening at SHN. I'm going to poll the group. Technically, you have the beauty of seeing them present their poster during lunch in our poster exhibit. So you could technically consume all of their time with your questions at that point. Or if folks have burning questions right now, maybe I can take 2 questions before we break for lunch. I saw your hand. You look like you really want to say something. You gonna save it for the poster exhibit? No, I'm coming over to you now.
Thank you. I just wanted to commend you on a tremendous accomplishment. This is really, really great. Just a couple of quick questions. Happy to chat more at the poster. In reflecting on what you've achieved, what would you say the barriers were to timely physician assessment prior to your intervention? Do you have a good sense of what those were? Just be curious to hear. And the second more technical question, which we can chat about later, how did you measure it? Because we struggle with that, finding out what time did a physician actually see the patient? How do you measure that? Do you look at, do they check in your EMR, or do you look at orders? Yeah, so that's my question. Thank you.
That's tough. The barriers. I think.
I think competing priorities for sure, and then I think lack of knowledge perhaps on the importance of timely assessment and the targets. I think once we outlined a target, it made things a little bit easier, as well as we did some rounds with the physicians too that I think really improved education. And
yeah, I think again, having the target and just having it identified, and obviously they're addressing biases and having the education is important. you know, and I think in terms of tracking, we use Epic, so it's very easy. The time a patient, you sign up for your patient, it's very easy data for us to get. So that was where we would start from sign up, and that's why, you know, we're also looking at the pain management side of it, because, you know, you can sign up for a patient and see the patient, but if it's still taking several hours or an hour for them to get their pain medication, it's both pieces are important. So getting them, you know, patients like identified that how important it is, putting them in usually a very acute room, a recess room, and then calling a physician like you would for any an MI, or, you know, there's a patient here who needs to be seen immediately. So it's really just, you know, once we had buy-in from everyone, like you know, if a triage nurse in our RN says, hey, come see this patient, we're like, done, we're there, you know. So I think it was just having everyone involved and know how important the timeliness of it is.
One more question? Perfect.
I just wanted to comment on that. My name is Kamani. I'm My name is Kamani. I'm the CPL for Pediatrics at Scarborough Health Network. But to address your question, when we met, we actually looked at each physician, and if they weren't meeting the target, we had senior leadership hold them accountable. So that really helped. Would you agree, Lana? Yeah, that's what helped. And we also with the triage nurses, if they weren't following the standards, like Morgan is the director for ED, she can, like, we would meet with one-on-one with them.
I think,
Yeah.
and again, I think once, like, the buy-in part, once you identify it and you say, hey, this is important, most physicians are on board. So I think it's just finding the strategy to get them there as fast as possible.
Thank you so much for that presentation, Michelle and Lana. I wanted to ask you a question because I've been approached today by two hospitals who have pediatric programs and are looking to extend into adult. We know that Scarborough used to have just pediatric sickle cell program. How easy was it for you to extend your program to the adult population? Maybe those hospitals can also learn from what you've done. Thank you.
I'm looking to Taylor because it was a harder transition than I think I had originally anticipated. As we know, in the hospitals, things are, as much as I said we're all very integrated at SHN, it's still different departments. So I'm the director of the Women and Children's Program. There's a different director for the adult program. So it's been a new experience trying to make a team that's fluid and goes between those two departments as well as emerge. And I think there was we're very lucky that we had a fantastic hematologist, Dr. Kevin Quo, join us and bring his wealth of experience. But, you know, there were some things, making sure that we have the correct criteria, that we're seeing, that we're caring for patients within the resources that we have at SHN. And I think there are a lot of differences between pediatric and adult care that we're lucky that we had the expertise to help guide us through that process. But it was definitely, it took longer than I thought to open the clinic, but I'm really happy that we did get there.
Round of applause for Michelle and Lana. Oh, my favorite friend has popped up on the screen.